Grab your anti-burst ball. We're going to set up for wall squats. Place the ball between your knees and bring your arms with the palms facing forward down by your side. Down by your sides. Imprint the backs of the arms, the triceps, the wrists. See if you can keep them against the wall as you work here. Your feet need to be about 1.5 to 2 feet in front of you. We're going to slide down the wall to where the thighs are parallel to the floor and the shins are perpendicular, creating a right angle with the thighs and shins. Ball stays between the inner thighs and you squeeze in on it. We're going to hold at the bottom, squeezing in on the ball for 4 counts, inhaling to prepare, and then sliding back up to standing on our exhale. So we lower on an inhale, squeeze in on the ball for 4, 3, 2, 1. Inhale, prepare, and exhale to slide back up the wall. Keep your tailbone anchored on the wall. This is a great chance to see if you really are keeping your ribs closed, because there should not be any space between the back ribs, the shoulder blades, and the wall. You want to keep them imprinted, the backs of the shoulders as well. So from here, inhale to slide down into the position. Make sure the knees are not tracking beyond the metatarsals, so the toes should be in front of the knees, but the knees should track between the second and third metatarsals. Once you're back up, check your imprint, back ribs, shoulder blades, back of head, neck shouldn't be pressing in, chin can be retracted like a double chin. And sliding down, pulsing in, 2, 3, 4, inhale, prepare. Exhale to slide up with the braced abs. Inhale to lower, tailbone heavy, back ribs pressing in, present on the ball. 2, 3, 4. Inhale, prepare. Imprint and brace the abs to lift you all the way back up. Take that ball, and we're going to set it to the side, grabbing a 3-pound weight, coming into a tightrope stance. If this feels too challenging balance-wise, go ahead and take a staggered stance where the feet are hip distance apart, but one is in front of the other. Once you've found your stance, hold the weight in the same arm as the leg that's forward. We'll take lateral flexion and add the bottom arm, holding here. Inhale 1, breathe, soft bend in your knees. Exhale 1. Inhale 2. Exhale 2. Inhale. And exhale back up through center. And repeating, making sure you're not rolling onto the outer edges of the feet. Feel weight in the heels, bend those knees. Weight in both the bones of the big toes, the baby toes, and the heels. Equalize the pressure. Holding that lateral flexion, adding the bottom arm. Make sure the palms are facing in towards one another. Another great chance to work on your lumbar extension, reaching the tailbone back, creating that arch in the lumbar. Keep your shoulder blades pinching together and your sternum reaching for your spine, so we close the front ribs and access the external obliques. You should have one more set to go. On your breath, inhaling to prepare, exhaling to brace those abs and contract the transverse abdominis. Go ahead and set up on the other side, finding either the tightrope stance or the staggered stance. And when you're ready, inhaling over, adding the bottom arm, exhale 1, inhale, exhale 2, inhale, exhale 3, and bringing your body back upright. Remember your checkpoints, your feet, equal weight distribution. You'll probably feel more weight in the metatarsals, the toes. I want you to find your heels and really ground them into the floor. Keep a soft bend in your knees so that you don't lock out and we don't get that supination or plantar flexion in the ankles. And you've got one more set here, taking it over. Closing those front ribs, bracing the abs on your exhale and sustaining the brace for the duration of the exhale. That's it. We're going to grab our heaviest Theraband and we're going to move towards the wall, standing profile. We're going to move in the transverse plane. We'll actually start facing forward and we'll turn profile so that we have the wall to assist us if we lose our balance. Now, balance work in the transverse plane is imperative because it's where 90% of injuries occur. So you've got your Theraband and we're holding it like a jump rope. We're going to step and find our balance in knee flexion as we did in the frontal plane balance work. And now we're going to loop the band around the arch of the foot and we'll extend the leg out. The leg does not have to be straight. I'd rather you keep the knee bent, but the foot dorsiflexed, and arch your low back. So if you're straightening the leg but rounding your low back, that's actually very bad for your back. It's much more important to me that you work with some extension in your low back and a deep bend in the supporting knee. Let's try it again on this side. Stepping to balance first, that's very important. Always keeping a soft bend in the supporting knee, weight in the heel, putting the band around the arch of the foot, and then tipping your tailbone back but firming your core, dorsiflexing the foot. Go ahead and take it to the other side, practicing the balance, turning, finding it, looping the band around, and then holding for 3 inhales and exhales. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. And repeat one more time on this side. Be cognizant of your checkpoints. Feel your heel heavy on the floor. Soft bend in the supporting knee. Don't go for flexibility here. Go for proper pelvic position, for strength in your deep layer of your core. That's what's going to alleviate chronic back pain. That's what's going to give you power and strength to bring the body upright so we don't have that forward leaning posture. Okay, excellent. Place the heaviest band to the side. We're going to take a anterior delt bicep release, face the wall, find a V position with your non-dominant arm. The outer thumb should be against the wall as you rotate around, twisting from the torso. The legs will follow. Soft bend in the knees. Close those ribs. Inhale, pull the navel in, lift up on the muscles that stop your stream of pee, and twist further as you inhale through the nose, draw the navel in, lift up on those muscles, firm them, hold the lift, and twisting exhale. Let's go ahead and switch sides. We're on our dominant arm side. We'll be here a little longer. Inhale through the nose, pull the navel in, brace the abs as if you're going to be punched. Twist into that stretch. Inhale through the nose, abs in, lift up on the muscles that stop your stream of pee, and twisting deeper into the stretch. Soft bend in the supporting knees. Feel that sternum reaching for the back ribs. Inhale through the nose, shoulders sliding down the back, abs in, brace, exhale, twist. One more, inhale through the nose, abs in, contract, and exhale, twist. Making our way into a quad stretch. Start with your non-dominant leg, grabbing the outer ankle, dorsiflexing the foot, and driving the thigh back. Soft bend in the supporting knee, holding it here. Quick release. Inhale 1, breathe. Exhale 1. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Going to 4. Inhale 4. Exhale 4. And let's set up on the other side. Soft bend in your supporting knee, weight in the heel. Grab the outer ankle, dorsiflex the foot. Collarbone wide, sternum soft. Inhale 1, breathe. Exhale 1, drive the thigh back. Inhale 2. Exhale 2. Inhale 3. Exhale 3. Inhale 4. Exhale 4. And slowly release that. Great work.